Start, guys. We're gonna do our in service today on post-mortem care. So, you want to come and join us, Miss SCD, right? How do you pronounce your last name? SCD. SCD. Okay. Yeah, we have a test right here. So we're doing our in service on post-mortem care. There's some questions, especially the caregivers. I did the in service today as well on post-mortem care and assisted living, because they were asking, what do we need to do for patients who just passed? What are our roles, and what do we say to the family members? And a lot of us, unfortunately, we've seen a lot of deaths. If you work in skilled nursing, you've probably seen a lot of deaths, right? Especially if you work for hospice, where, like, again, when I used to work for hospice, when I make a visit, it's usually somebody who's died, or somebody who's not having, or is about to die, right? So I go over there and try to make these visits. But there's specific things that we need to consider when somebody dies, and a lot of it has to deal with how do you communicate to a family member who are grieving. And then also there's some certain things that, like, for example, um, the Jewish community have a different preference when somebody dies, in comparison to somebody who's a Buddhist or something like that, right? They might say, hey, you know what, I need the body clean and prepared, and in a specific gowns or clothing. Within 4 hours, we got to get this body out of here, because, like, in the Jewish community, you got to bury the body within a certain amount of time, right? So it's usually like a fast-paced thing. Certain culture, they don't want you to even touch the body if you're a certain, like, gender, right? So it's very specific. And I've never, here in skilled nursing, usually if there is something specific like that, it's already care plan, and we already know, like, moving forward, what we need to do after that, right? um, but some of the things that we face in terms of challenges is, how do we communicate with family member who's grieving, right? Like, what are some of the right phrases we need to say to family members, right? So this is, I'll tell you guys what I usually say to family members. Usually when I come in, like, I walk into a home, right, and the family members, I try to gauge them how they're feeling, right? If you walk into a room and everybody's, like, celebrating, right, there's times when the patient has gone through a lot, and they're just really relieved that the patient has passed, right? I've seen patients who are gurgling, having pain, and having trouble breathing for, whatever, 48 hours, and then having them pass is like, it's like a monkey off the shoulder, right? Like, she's actually comfortable now, you know. So there's times when I walk in, and people are just, talking, joking, and they're celebrating. But there's also times when I walk into a room where everybody's quiet and crying and grieving really hard, right? So it's different for everybody. But if I walk into a room and the family members are grieving, they're quiet, the best thing you can do with the family members, what would you do when you come in? If you walk in as a nurse, and let's, for example, you came into room 5, all right, and you came in and the patient has passed and the family members are sitting quietly and grieving, what's the best thing to do? Yeah, sorry for your loss. And then you can sit there with them, and just quietly standing there, right? Like, because even though you're not really doing anything, by just standing there with them, they feel you, they feel your presence. It's more or less like an emotional support, right? Quietly, you're sitting there. It feels good for them to know that, the staff is here who's taking care of my mom or my dad, and they're here to support us by standing there quietly with them and grieving with them, right? Absolutely. And then you can also say, hey, I'm sorry for your loss, as you had mentioned, but if you need anything, I'll be outside. I'll give you guys some time to grieve, but if you need me here, I can also be here, right? So there's not a lot of stuff you can say to family members, and there isn't. I mean, if they're quiet and they're not saying a lot of stuff, I wouldn't say a whole lot of stuff either. I would just sit there quietly with them and grieve with them, right? If they're on hospice, or if you have social services, you can offer that. You want a social service to come by and call you. A lot of times, chaplains or social workers, they'll come by and, like, pray for the body, or social worker have a certain role in patients that are actively dying or already has passed away, right? They're trained on, providing good emotional support for these individuals. Okay, so offering social services is really important when family are grieving, or in a difficult grieving period. Okay, so those are really important. Now, let's just say that the body's there and the patient has died. Um, as a CNA, as a caregiver, we can't touch the body. Really, we can't really do anything with the body until the nurse say, hey, the patient has died at this point and this that we notified the doctor. It's okay for us to do post-mortem care. Okay. The reason being is that if that deceased, right, if the individual who just died had a fall 72 hours ago, had surgery 72 hours ago, or within the last week, right, and or had a medication that was given incorrectly, and now that patient has died, it can be a coroner's case. In which case we can't touch it, right? So we need to call the county, call the coroner, and then they come pick up the body and do an investigation. And so who's ever had that situation where the patient who died is a coroner's case? Nobody. Okay. So it doesn't come up a whole lot. Okay. And as a hospice nurse, though, I've dealt with it many times. And this is the situation. A lot of them, what's happened is that this patient has fallen 5 6 days ago, and then they hit their head, and then now they're declining, and then they died. Okay. And that is a case of coroners, right? Your death is related to a fall, regardless whether you're in hospice or not. You died because you fell. You didn't die because you had cancer, right? When you're in hospice, you have 6 months or less to live, right? But you died way before that, and you start declining because you had a fall. And the reason why it's coroner's case is that they want to bring it in, and if the fall is indeed, if the death is indeed related to the fall, were we negligent in our care, right? Like, did we provide the right care? What was the reason for the fall? You know, and this was really important too. Like when we have a fall, that the CNA writes down a statement saying that I took a break at 10 o'clock, and this patient was laying in bed, and at 10:05 the fall occurred. It was a 5 minute period. It's not a 2 hour period where we didn't see him, right? So it's really important when in terms with if it's a post mortem care is related to a fall. Also, if the death is related to a medication, maybe we did an incident report the day before, we gave the wrong meds and the patient died, right? That's a coroner's case, right? There's also like surgery. They had surgery a week ago, and now they have an infection. They threw a clot. They had a stroke or a heart attack, secondary or pulmonary embolism, right? Secondary to the surgery. That's a coroner's case, right? Maybe the doctor's negligent. Definitely, it might come back on us. Like, hey, you're supposed to be walking this patient every day. You guys haven't walked him for a whole week. Yeah, of course he's gonna throw a clot, right? So not too scary in any way, but it's just that's how things work in terms of somebody who dies, right? So we just got to be careful. We can't pull like nurses. Once you've cleared that, they say, hey, the patient took her last breath at 10 o'clock. If the nurse showed up at 11 o'clock, the death is going to be at 11 o'clock, because it's not the CNA that's calling the patient when she died, when the last time she took her last breath. It's the nurse who comes in that listens to the heart and then calls the doctor and say, hey, there's no more breathing. The pupils are fixed. The body is, rigid. There's clinical signs of death here. So the time of death is going to be the time when the nurse comes in and does all of that clinical assessment and calls the doctor and confirms the death. At that point, then we can do our post-mortem care. Okay. And sometimes the nurses too will remove all the tubings, right? It could be Foley catheter, it could be suprapubic catheter, but whatever is hanging out and that needs to be removed, at that point we can do that. Okay. There's other times when we can provide post-mortem care and the body is a whole body donor. Yeah, you've heard of that before? They go over to UCSD, right? And you're probably familiar with that because that's kind of like your work, right?
Yes.
Yeah. So a lot of times, if the patient has a complicated diagnosis, and then the family said, "Hey, you know what? We want to donate the body, my mom's body, to UCSD because they're gonna do, study on it, right?" In that situation, when you hear that somebody is a whole body donor, you want to put some ice over their eyes, right? I know it's kind of weird, eyes over your eyes, but it kind of preserves the eyes, kind of keep it cool, right? Because it might take them 2 hours to get there, and that's just one of the protocol we want to do when somebody's a whole body donor. We want to put something cool over their eyes, right? So ice pack would be good. Um, but yeah, in that situation, you can't provide post-mortem care. Do your peri care, get the patient cleaned up, or the deceased cleaned up, and just get him ready and listen to the nurse what you need to do in terms of your post-mortem care. But the general care for resident for a patient who just passed is that just think of your body has a lot of sphincters, right? When you're alive, all these sphincters are working. They're closed. They're preventing fluids from going up. They're preventing fluids from going down. If you have fluids in your stomach, it's not gonna go up because you literally have something here that prevents it from going up, right? And down here too, in the sphincter, kind of like right there by your stomach, that prevents things from going down. And at the very bottom, the rectum has sphincter too to keep bowel movements in, right? Even your bladder has sphincter to keep urine in. But once you pass away, these muscles relaxes, and so yes, you're gonna have some bowel movement that might come up. You might have some urine that comes up. You might even have some bodily fluids that comes out of your mouth, right? So it's really important to change the incontinence pad, put a new gown on, wash your face, clean the clean the hair to get the body ready, right? So these are your general post-mortem care, to get the body ready. And where it gets sometimes when a patient is dying, is progressively declining, and it's been 7 days, 8 days, and this patient hasn't eaten in weeks, right? Yeah, you're not gonna have urine coming out because they're dry, right? They're not gonna have bowel movements because they've been actively dying for the last 2 weeks. But for patients who has a sudden death, right? They were eating last night, drinking, and all of a sudden they die. They have a heart attack or a stroke, right? And these patients is definitely are gonna have some fluids coming out. So it's really important to do your peri care, get them cleaned up before the family member gets there. Okay. Um, when the mortuary comes in, not the mortuary, but the mortician comes in, they're generally going to be looking for a med tech or a nurse, right? They're going to want to know what time they died. I need certain information. These things are we're not going to be able to help the mortician out. You're just going to have to point them out to the nurse. Okay, they might ask you what time they die. You're gonna have to talk to the nurse because I know they stopped breathing at 10, but the hospice nurse got here at whatever. And it doesn't have to be a seat rest. It could be at a assisted living where there's no nurses and you're waiting for the hospice nurse to come in, and you know that the patient died at 10, but the time of death is really gonna be 11 o'clock. So are you gonna tell the mortician that the patient died at 10 o'clock? You're gonna say I don't know because the nurse came in at whatever time. Okay, so you'll just defer them to the nurse basically. Okay, what are some of the equipment you would use when you're taking care of somebody who just died? It's universal precaution, so you're using a lot of it is just gloves. If you have fluids and if the patient had COVID, yeah, you're gonna put in all your droplet precaution, right? It could be a mask, could be a gown, could be gloves, and so these are just universal precautions that you're applying. Okay, but 99.9% of the times there's no infection, is there's no diseases that can potentially be spread. It's just going to be gloves. Okay, and how to position the body for family to come in to visit is usually just keep them supine, right? Supine means kind of like on their back, and then keep their feet straight and their arms straight, right? And if people sometimes ask, do you keep their head up? Yeah, you can keep the head up, keep the eyes closed and the mouth closed. Just make sure that you wipe down the body nice and clean. Keep them, and then comb the hair as well, right? Because a lot of times I come in and it's like, you know, the facility said, "Oh yeah, we did the postmortem care," but the eyes are all gunky and the hair is not fixed. Just because the patient has passed away doesn't mean that we can't provide this care, right? We have to keep the body presentable, and all it is really a wet cloth, washing down that face and then cleaning the hair, right? It looks presentable, like we did something for this patient who just died. Um, let's see what else. What are some of the what are some of the challenges that you guys face when somebody dies, or like you feel like you're not comfortable or you're not confident in doing? Yes, sir. For confused resident. Yeah. So for confused resident, I mean, if you know her reaction to, yeah, yeah. If they're confused, if you've noticed that in the past, if you told them the truth and they're okay with it, I would just continue to say that. Just remember, hey, your wife passed away a while ago, right? But if you've done it before, and then the patient reacts to it in a violent way, like or in a way where she's very emotional, then I would just say, hey, you know what, your husband will be back. You can say that you're at the hospital right now. When you get better, we'll go home. your husband will be there, you know. Um, but just knowing your resident, how they react to your responses is going to be really important. Because if she is indeed confused, if you tell her something within 15, 20 minutes, she'll forget anyway, right? But you don't want to keep re-triggering the the emotion. But a lot of times though, like once you reminded them, sometimes they remember, oh yeah, you're right, and they're okay with it. So if you know that and you know the response, the resident's response, it's okay to remind them, hey, yeah, she actually passed away. Like, remember 10 years ago. And if she can't handle it, then hey, you're gonna have to go with the flow. Yes, ma'am. You leaving? Okay. Okay. All right. Thanks. Um, so just really knowing your resident and know how they respond. It's okay. Try it out. Like be like, hey, you know what? Your husband died. 10 years ago. But if she's emotional, don't say it again. Just next time, just like, you know what? You're here for rehab. When you get home, you'll be able to see your husband. Okay. Or you can say, hey, you know what? I'll give him a call. I don't know where he's at, but I'll give him a call. You know. Uh, and so a lot of times they'll be like, okay, right? And a lot of times too, when residents will be like, it's time to eat. It's really not time to eat, but I just tell them we're getting ready. We'll get you ready soon, right? So, any other questions about postmortem care? Role of CNA, what roles are infection control? As I mentioned, universal precaution. Um, you're looking at just really doing a clean bath of this resident with the use of a wet rag or towel. Um, let's see. Let's go over the test real quick. See if you guys don't have any questions there. Okay. Go over the test. Like I said, this is pretty easy. True or false? Only a nurse or physician can legally pronounce death. That's true, right? Yeah, that's true. Which of the following is the most appropriate first action after a patient is found without signs of life? That's C. Yeah, yeah, yeah. Remember, um, get it confirmed first. Make sure that it's not a coroner's case. And make sure they're not a whole body donor. And you can do all this stuff, right? Um, where are we? For which of the following tasks are typically part of a CNA postmortem responsibilities?
Oh, three. Three.
Huh?
That's
Three?
three.
Oh, three. Yeah, yeah, oh, yeah. True or false? It's appropriate to remove medical devices or lines before confirming whether the death is a coroner's case. That one's false, right? Remember, we wait, we wait. If it's a coroner's case, you're not touching that body, regardless. Okay, they're gonna take it in and they're gonna investigate. All right, and four, which of the following tasks are typically part of a CNA postmortem responsibilities?
D. How was that about?
Yeah, yeah, but we don't really do applying the ID tag, so that's okay. But A and B, and that's fine. When positioning a deceased body, what is the recommended position?
Fine.
Supine with arms, legs extended. Yeah. And then legal documentation requirement. Oh, what the heck is this? This is the wrong one. I'm on the wrong page here. True, six, right? Family members are not allowed to be present during postmortem care. You think that's true? That, that's false. Yeah, yeah, yeah. So family has an option to be there when you're providing care after the death. Okay. You can kindly ask them, hey, do you mind if I provide care for, I'm gonna go and clean this up, this and that. But they absolutely have a choice to be there when you're providing postmortem care. Okay. All right. Which item should be used to absorb postmortem leakage from the body? Hmm? Yeah, yeah. See, adult brief or pad. Yeah. Which of the following is not part of standard postmortem care? Yeah, yeah, yeah. We're not gonna be inserting a feeding tube. And then, true or false? Cultural and religious considerations should be ignored once the person has passed. False. Yeah. Like I said, sometimes family members will ask you, "Can you go and put these specific clothing on them?" And we needed to be doing that. Which of the following best demonstrates respect during postmortem care?
We don't have that. D. Where?
You don't have 10?
Oh, this one. I did.
You did D. Yeah, okay. All right, both B and C. All right.
So
Any
for
questions,
four,
comments?
all, even though it's not C,
Which one?
for four.
Yeah, I would just put, yeah, ID tags. Yeah, yeah. Even though we don't really do the ID tags. None of the skilled nursing have that. That's like a hospital.
Right.
In a hospital. Okay. Any questions, guys? Any comments? Anything you guys want to add? Tell us. No. Okay. Perfect.